So when I was a junior doctor, I had a general surgeon that I really respected, who I was talking about future careers and sort of, the difficulties of getting onto the training program, particularly in orthopaedics, which is what I like to do. And he said that, I wondered about doing something that was a little bit easy to get onto. And he said to me, don't ever settle for a training post that's not what's going to really drive you, because you're going to be doing this for the rest of your life. And so if you make a compromise and you don't sort of you don't actually you settle for something that's not what you're going to really love, then the rest of your life's a long time to be doing something that you're not that passionate about. And so that really sort of is one of those sort of key decision points where I really think, I think he's right. I think this is something that I'm going to be most passionate about, and really sort of help me lead more towards that. The second bit of advice I thought was good was the actual interview process. So another one of my mentors said to me, look, if you don't, you've got to treat this exam, this interview to get onto the training program like the most important exam in your whole career. Because if you don't do it and you don't practice for it and prepare for it, then you can't do any of the other exams. You can't do the fellowship exam if you don't get on the training program. And so that was that sort of made me sort of focus and target down much more on that exam to make sure it was like I made sure I was prepped for it very well. Another bit of advice that I got just outside of medicine that I thought was really good was from a surgeon here in Hobart who said, when you get back and you're starting your private practice, don't get a huge mortgage, because it'll be hanging over your head, and even if it subconsciously alters what you do or why you do it, it's a terrible outcome to have, and a terrible thing to have sort of looming over you. So that's always been something good, something that I've sort of thought, that makes a lot of sense. And then lastly, the last bit of advice that I like was from Martin Richardson, who said to me, make sure you look after your anaesthetist, because particularly in a private practice, when you get a bit of downtime in between cases whilst they're doing the anaesthetic, in their practice, they don't get any downtime. They basically are working hard in between cases when you're relaxing, and then when the patient's asleep and you're doing your job, they're still working. So he was really good at bringing them coffee and making jokes and making sure they were well fed and giving them enough time to sort of to actually have those things. So that's probably the advice that I look back and think, that's all for my practice. I was lucky that I got to do a couple of overseas fellowships. So I did 2 years in Canada on 2 separate fellowships. And so I think when I compare ourselves and my training, and I compare that to the trainees over there, I think we do train excellent operative surgeons. And I think the exposure you get as an unaccredited, and then as throughout your training as a trainee, is really good. And I think there's good focus on getting operative numbers up and operative experience. So I think that's something we do very well. I think as a group, Australian orthopaedic surgeons are collegial and work well together and good communicators, and so it's really pleasing to go to to Australian-based meetings where you see lots of people that mentored you and taught you, and it's a good atmosphere. I find that's really interesting and good, nice. But one thing I don't think we do quite as well as they do in North America, particularly the academic centres where you typically would do a fellowship, is research, and that's just the setup. The American and the Canadian systems are so well set up to do high quality randomised controlled trials in surgery, and they do it because it's funding given to it, and the surgeons are given time enough to do it, and so the positions are funded, so you're not working for free in the middle of the night, in between your busy clinical practice. I think sometimes here in Australia, we, the most famous surgeons here are the sort of surgeons that operate on the sports people, whereas in Canada and America, the most famous surgeons there are the ones that are most well published. And I think realistically, being a published surgeon and doing good research changes practice globally, whereas being really slick technically changes people's outcomes very locally. in my life where I've got a busy, young family with very busy life. So I've got 3 kids between 6 and 3 months. And that's a huge part of my motivation. And it really changes how I practice a little bit, because I'm really mindful of getting home on time and not working too hard, not working too late, not working on the weekends. My wife's a surgeon, so the combination of the two of us being pretty busy is certainly a challenge. So that keeps me busy and is probably my main focus, realistically. Outside of that, I love cycling, so I love the mountain bike and I love the road bike, but at the moment with my life as it is, I really have to do that incidentally. So for me, I can easily ride to work, and it's about 15 k's each way, and that's pretty easy. It's sort of exercise for free, because it doesn't dramatically alter how long it takes me to get home, but it gives me some exercise and some thinking time before I get home. So that works well. I also use a wind trainer if I've got a kid nearby to sleeping, that I can do in downtime when he's asleep. That works out pretty well for us as well. And then I think the last part of that is not letting the work take over. So that's one of the things. Family is really important to me, and I sort of saw in my training that often surgeons that were doing regular Saturday lists and the like, hey, we're not still married to the first person they got married to, and I reckon that just seemed to me a recipe for disaster. So I'm actively mindful of not working longer than normal, getting home at a time when I can still be an active member of the family. So that's important for me as well. It's really important to treat everybody equally, and so that ranges from the staff you work with and the ancillary staff, as well as the patients you see. And if you're fair and even and listen to everybody, then I think it really helps the whole process move forward. I think being inquisitive about the members of your team. So when, particularly in your private practice, you'll have a pretty regular team, but even in the public department, if you listen and are inquisitive about the lives of those that you work with, and then you listen to their answers, and then they, I reckon that just helps solidify and cement that team to be quite adhesive. Sometimes it's hard in the midst of surgery not to get a little bit stressed, and I often find that if I'm finding I'm feeling a bit grumpy in the midst of a surgery, it's actually an indicator of my stress, not that someone else is not performing. It's more I'm feeling anxious about the move I'm doing, or the surgery I'm doing. And so I reckon, I'm very mindful to bite my tongue and not sort of not bite out or be grumpy, because I reckon that just sort of sours that relationships if you're sort of a bit unpredictable. So I just bite my tongue and keep doing what I'm doing, and mindful internally that it's probably me that's the one who's having a hard time here, not that anyone else is making that hard time. And I reckon all of that works, that communication style and that being inclusive and listening to people, I think it all works together to bring your team closer. And the closer your team is, and how they'll work really hard for you to help you out. And they'll come in after hours to help you, or they'll work late if you have to for an emergency, or they'll volunteer to do your list if you need to do extra emergency stuff. And so I think that sort of being part of a good team is the most important skill I try and pass across to my junior doctors. And I think the most interesting and my favourite book that I read recently is Boy Swallows Universe by Trent Dalton. It's quirky. He's got a great dark humour. He does fabulous character developments, and after you sink your teeth into it, you get to the point where you just can't put it down. So I thought that was a fabulous book, and really enjoyed it. Really recommend it.